as Al mentioned, we are going to talk a little bit of caregiving this morning. For all of the panels, we have the bios in your electronic virtual packet and online on the CVent site. So I'm not going to go into really great detail about our speakers other than to say that I've worked with both of them for many years, and if I wanted to talk caregiving, it would be with these two people. Bob Stephen is our lead for caregiving at AARP across the entire enterprise and a vice president in our programs department. And Rhonda Richards does our federal advocacy work on these and other issues in our government affairs department, and she and I have been colleagues for about 17 years now. So I know her work well and trust her. And what we're going to do with this panel is we're going to have a little bit of a roundtable discussion, and then we'll open it up to questions from you all. So without further ado, I think I'm going to just dig in, although, we have one slide from Rhonda we'll get to later. But why don't I start with a question for you, Bob, as our issue lead here at AARP, so you understand everything going on in the enterprise. Why is family caregiving such an important issue for us at AARP?
Oh, thanks, Adam. And first, I want to say it's really great to be here with all of you. I come from a long family line of educators, so this is a very special opportunity for me to be here. I guess to get to Adam's question, Maury somewhat touched on the fact that caregiving's in the DNA of not just AARP, but NRTA, because Ethel Percy Andrus was a caregiver. It's what led her to leave her role as a principal. And we've been working on the issue for decades because it's important. But roughly 6-7 years ago, we as an organization said, we need to elevate certain issues as social mission priorities for us, and family caregiving was the first one that was chosen by AARP. And it really is because of, you look at long-term care in this country, and there really isn't a system. I mean, loosely, most of that long-term care is being provided by family members, neighbors, friends, even acquaintances. And it's at often great cost to those family members, to those family caregivers in terms of their time, their own health, and their finances. And we've seen, because of a couple of different things happening, the demographics, more people aging, needing care, so there's a greater demand for family caregivers. And at a time where maybe the population that would traditionally be a family caregiver has gotten a little bit smaller. The other thing we've seen is that more and more things that used to be done in a clinical setting have now been shifted over to the home. And so it falls on family caregivers typically to do things that in the past would have been done by maybe nurses. Things like changing wounds, administering complex medications and so forth. So we see that shift has really created more of, it's extracted more of a cost, and we see that that's just going to get worse over time. The other piece is the financial, that family caregivers on average are spending $7,000 plus, and that was from before the inflation started hitting, of their own money. And for some, if you're not making a lot of money, that could be 50% of your income that you weren't planning on. And so we see that, from our perspective, this is such a critical issue because we have to make sure that family caregivers are supported. That it can't be sustainable to just keep doing what we're doing, and that's why the great work that Rhonda is going to talk about with advocacy and our programs is just a starting point. But it's really kind of what drives us in terms of caregiving.
Great, thanks, Bob. And as Bob mentioned, Rhonda does come at this from the advocacy perspective, which is where I started at AARP and still obviously work on advocacy issues with you all. So Rhonda, from the advocacy perspective and from the broader perspective that you have working with Bob and everybody else throughout the enterprise, why are we so focused on supporting family caregivers?
Well, first of all, thank you for the opportunity to be here today and join you. I'm actually married to a teacher, so I have that perspective as well. And as Bob noted, in the DNA of AARP. So thank you for the opportunity to join you today. And I just want to build on some of Bob's comments. Caregiving is something that really just impacts really everybody. If you haven't been a caregiver, you are a caregiver, you will be a caregiver, or you might need the help of a family caregiver someday. It really just impacts everyone across, age, across all sorts of demographics, whether you're in a red state or a blue state or rural or urban or suburban, whether you're African American, Black or Hispanic, Latino or Asian American, Pacific Islander, it doesn't matter. There's people in your life and people that need help, and so many, over 48 million family caregivers in this country are helping family and friends and neighbors when they need help. As Bob said, everything from medical nursing tasks to help with eating and bathing and dressing, coordinating care, finding a home care aide if someone needs help to stay in their own home so they don't have to go into a nursing home. There are just so many things that family caregivers do day in and day out, trying to navigate the system, find the help that they need for themselves or their loved ones. And Bob talked about the financial costs as well. That's why AARP is fighting for things like a family caregiver tax credit, which I'll talk more about, and just all sorts of supports from respite to paid family leave, financial and legal supports, help with training, just all sorts of day-to-day needs that family caregivers every day across the country are facing. And we do that nationally, we do that at the state level, we do that at the local level in communities across the country. Our 53 state offices are extremely active on these issues, supporting family caregivers, helping people live in their homes and communities where they want to be, helping folks that may live in other residential settings like nursing homes or assisted living, whatever the case may be. So caregivers really need common sense solutions to help sustain and support them in those caregiving roles that they're doing every day. And AARP has been fighting to better recognize and support them for years. And I'll talk about this more, but actually next week there's going to be a release of the first ever national strategy to support family caregivers. And that came about as the result of advocacy from AARP and many other organizations through passage of a federal law called the RAISE Family Caregivers Act. And RAISE stands for Recognize, Assist, Include, Support, and Engage family caregivers. So I'll touch on that more as well, but those are just some of the many reasons that AARP is fighting to support family caregivers in states and communities across the country nationwide.
Great, thank you. Yeah, absolutely. And Rhonda wouldn't say it, but she was the key person at AARP on the RAISE Act and did fantastic work on that for years. So thank you for that, for leading that effort. And I did mention that Bob is in our programs department. So in addition to that overall lead role that he's talked about for the entire enterprise, he's in programs. So Bob, how does the work of AARP programs support the organization's caregiving advocacy agenda?
Yeah, and I'll come in a little bit broader, so programs including information and content that we have. And some of what we do in terms of support probably makes, is very obvious. So as Rhonda's talking about, she mentioned the tax credit. So we're fingers crossed that we continue to fight for that. But when a law is enacted or policies are enacted or regulations, there's a role for education in terms of making sure that people are aware of what is now available to them and how to access that. And so certainly, tax credit is going to be important to help people understand that it's available to certain people. This is how you qualify. These are the things that you need to do. We've seen examples where if that education doesn't happen, people just don't take advantage of it. So in Arizona, there is a tax stipend that pilot that was approved a couple years ago, but it's very complex to actually make use of. And so as a result, a lot of organizations have not been promoting that. AARP has been. But, and then once you actually go into it without the education, it's very tough to actually understand, what you need to do. You need to keep your receipts. You need to submit them in a certain way. And, unfortunately, right now, in talking to our Arizona State office, the program may end because not enough people are taking advantage of it. And so they're looking at it as there's lack of demand. So that's one of the primary ways we look at it from a program standpoint. There are a couple other ways that we look at that complementary aspect of working with advocacy. One is there are certain instances, primarily at the state level, where we just can't do something from an advocacy standpoint that we could in other states. Paid leave is a really good example of that. In some states, paid leave has already happened or is expanded. In others, it's not going to likely occur, and we need to find other ways to address that. Paid leave is important because 60% of family caregivers work, and that's an area where they really need support. And so, from a program standpoint, we can do I guess we call it little a advocacy, where we're working to convince employers that supporting family caregivers is very important. Look at providing resources so that we can help them support their family caregivers. And so we do quite a bit of that. We've probably, at this point, in the last 2 years, we've reached about 5,000 employers. Interestingly, some of the more eager employers who've asked for this type of information and help have been school districts. So we just raise that as an interesting point there. And I think the last way is caregiving is very personal. And if we could secure all the things from an advocacy standpoint that we could, it's still going to be a very personal issue. And caregivers are going to need help to be able to figure out, okay, what do I need? What kind of a plan do I put together? What are the things that others have gone through that I don't have, that maybe I can learn from? And so it really complements the advocacy that we're doing to be able to have those resources and the education available. And I think it also helps us, our case, when we can go to lawmakers to say, look, we're not just asking you to do this, look at what we're doing. We're providing these resources as well.
Great. And let me stick with you for a second there, Bob, because you mentioned that it's personal. You mentioned the program in Arizona and people not utilizing it, and that drives me crazy because we do all this great work and create these great tools for folks, and they're not taking advantage of it. So, you've mentioned the extensive caregiving resources that we have. How can caregivers find those resources that are available in their community so that they utilize these sorts of programs?
Yeah. So there are broad resources that we provide for everyone. That would be simple things that it's not going to really depend on where you live. You need to make a plan for your caregiving to understand the key things that you're going to do, and generally our strategy for that is that we want to make sure that for those top items that are important for caregivers to know, no matter where you live, that we have the best information and it's accessible and it's readily available, not just within AARP, but where caregivers are. I believe there might be postcards out there that will have some of this information in terms of phone numbers and so forth, but a really good place to start was in AARP's caregiving website, which is just aarp.org/caregiving. Basically everything that I could mention will be accessible there. But just to highlight a few of those, the caregiving guide that is what I was referring to in terms of creating a plan. But things are very local and personal, as Adam said. So we've created for every state a state resource guide that our state offices have curated the organizations that they rely on to support family caregivers, and those are available through that website, and also then are distributed by our state offices personally. Within our website, we have we call it the Community Resource Finder, which is a partnership. It's a tool that we developed with the Alzheimer's Association, and within there you can put your zip code and find the resources that might be available there. And then kind of as a coming attraction, we've been working with United Way and the 211 network. And so 211, for those of you who aren't familiar, you call 211 in your community. It's available for most folks across the country. They'll connect you to the social services that will address your issue. And already probably about 3.5 million family caregivers use that on an annual basis without any type of awareness. We're working with United Way and 211 to build awareness, but also make sure that if a caregiver calls that number, they get a better experience, that the operators are trained, and that there will be more resources available, because then you're able to talk to someone who lives in your community and knows exactly, okay, this is the best organization. You want to go, if you're going to go down there, you want to use the second door, not the first door, and this is who you ask for. And so we're starting that. We've got it in 13 markets right now. We're going to do a little bit more in Florida and Georgia, but our goal is 3 to 5 years from now that is nationwide and available for everybody.
Fantastic, thank you. And now I get to ask a fun question of Rhonda, because I am from the advocacy background. And one of the things that we all know about advocacy is you can do a lot of great work to get some legislation passed, and if nobody knows about it, you didn't really do it. It's important to get that message out there, not only so that folks know that they can take advantage of these things, but hey, so you could say, we worked on that and we get credit. So here's the fun question, Rhonda. What successes have we had on caregiving advocacy lately?
All right. Well, this is an important question. And AARPs, I'm going to start with our state offices, because AARP, as you probably know, has 53 state offices in the 50 states, DC, Puerto Rico, and the Virgin Islands. And we actually have the slide when you see it later. There's actually a link that has a link to a map where you can actually look at the wins and successes that we've had in state advocacy in different states. So if you live in Idaho or Maryland or California or Maine or wherever it may be, you can look up and see what AARP has been fighting for and has successfully enacted or done in your state to help support family caregivers. So that's an important resource, and I'm going to talk about some of the areas that our state offices focus on in caregiving advocacy at the state and sometimes the local level as well. So this year, one of the things that AARP actually over a number of years, as Bob was talking about, has fought for in states, and now 44 states and territories have something called the CARE Act. And that's really around recognizing family caregivers and offering training to them around hospital discharge, so that they are identified in the medical record of their loved one, so that they know when the discharge is going to happen, and that they have an opportunity to have training of the tasks that they may be doing when their loved one comes home from the hospital. And as I said, Georgia was the 44th state to enact the CARE Act this year in 2022. We also advocate for legal supports in terms of guardianship and power of attorney laws in states across the country, and care access through telehealth. And this became even more important during the pandemic, when sort of the use of telehealth really exploded, including in Medicare, because there was just a need in terms, it was done, initially sort of for safety, so that, you weren't getting, people weren't getting sick, healthcare providers could provide care without having to put themselves or their providers, at increased health risk. But it also really helps older adults and their caregivers who may have physical limitations getting to the doctor's office, getting transportation, caregivers if they want to go taking time off work to accompany their loved one to the doctor's office, for example. So our state office have really been working on telehealth, and this year alone, at least 10 state offices successfully advocated for improved access to telehealth, including in states like Alaska, Hawaii, Tennessee, Kentucky, and West Virginia. So a number of states. We also have states working on nursing scope of practice and expanding access to home care services and financial supports like cash stipends or long-term care benefits or caregiver tax credits, as we talked about, as Bob talked about. Our Arizona state offices a few years ago fought to get the reimbursement program there. And the pandemic also really highlighted the importance of paid family and sick leave, as Bob also mentioned, because caregivers needed to take time off to take care of their loved ones who might have COVID. They might need to take time, if a home care aide can't come and they're pinch hitting because the home care aide had COVID or needed to take care of their kids. And this year, for example, both Delaware and Maryland state offices successfully advocated for paid leave policies. And right now, 11 states in DC have enacted paid family and medical leave, and 14 states in DC, along with a lot of other cities and municipalities, have paid sick time. So that's an example of local advocacy. Also, respite care. This is one of the most important services that family caregivers want, sort of a temporary break, someone to come in and help take care of their loved one while they can go out and get groceries or go to their own doctor's appointment, or, adult daycare, for example. And about 38% say respite could help them of family caregivers, but only about 14% actually use respite. So there's a gap there and a need for more access. So our state offices fight for sort of state-specific respite care programs and things like that to make sure that those are available. And this year, at least 3 state offices, Montana, Alabama, and Tennessee, have successfully advocated to expand state respite care programs. And I'll just mention federally that last year we were successful in getting an important investment in increasing access to home care in Medicaid, and also supporting the workforce that provides those services, funding for strike teams in nursing homes to bring in sort of extra staff and resources when there are COVID outbreaks in nursing homes. And we have more support than we've ever had in Congress for the Credit for Caring Act, which is a family caregiver tax credit of up to $5,000 annually for eligible working family caregivers to help offset some of the costs that they may have for things like home care, transportation, home modifications, respite care, a home care aide, things like that. We have over 70 co-sponsors in the House and over 20 in the Senate. So we will continue to fight for that as well federally.
Fantastic, thank you. And I have one job up here, which is to facilitate them. And I know you had one slide, Rhonda, and it was with all of this stuff on it, wasn't it?
It did have an
And I didn't call it up. So if we could
right.
get the slide up, we'll have it up there for the rest of the, there we
Yeah, there
go.
you go.
Thank you. So you can see it while we finish the talk. Thank you, Rhonda. And I think I'll take a moment to make the plug, because Rhonda talked about all this great advocacy work. And I know that a lot of you work on advocacy with your members and may work with your state office. So this is where I put in the plug to say that your state office is certainly working on something related to caregiving. And if it's an issue that is of interest to you, both from the advocacy side and the education side, getting the word out, I would encourage you to work with your state office, and I am happy to facilitate that and be part of that relationship, because caregiving is a massively important issue. I know to our members at AARP generally, and to all of your members at the Retired Educators Association. And it's important to me, as someone who has provided caregiving and as someone who is using this next question, to sort of plug something that I did when I took a temporary assignment working on Bob's team last year. Can you talk about, Bob, the tools that AARP has to help caregivers manage their finances?
Yes. And actually, Adam was doing a temporary assignment because I needed caregiving at that point and was out for a little while. Yeah, we as I mentioned, we try to, at AARP, look for the gaps where there may not be something that exists and you know, that we're trusted. And the financial aspect of caregiving is an area where family caregivers expect AARP to offer something. And when we looked at it, you know, we knew the numbers. We have advocacy solutions that we're pushing. But what we found was that there really was a gap in helping family caregivers understand the nuts and bolts of what, you know, their financial situation was going to be. You know, there was a lot of talk and still a lot of discussion, but in the financial industry, but it's more about financial planners wanting to help people, you know, plan for their future in retirement. It wasn't about what do you need as a family caregiver. And so we worked with an amazing woman, Jessica Allen, who is a certified financial, counselor, couldn't feel the word. And she was also a caregiver for her husband, Chaz, who lost both of his legs he was in the Army in Afghanistan. And so she had the knowledge of being a caregiver, but also helping other people and knowing that, you know, you need to build a budget, you need to look at a variety of things and you know, to avoid some of the mistakes that lead to, you know, these negative financial outcomes, like you know, people tapping into their retirement savings just to pay for their caregiving. So we developed a workbook, and that is available through our website /AARP.org/caregiving. If you want to go directly to where it's AARP.org/caregivermoney. But then so that is freely available. We're also we've created an education module around that state offices and their volunteers are able to offer, and you know, we're looking to get more of that out there. But it really has it's just a few years old, and it's really resonated with folks.
And that guide is fantastic. It was something that, as Bob mentioned, Jessica wrote, so I had nothing to do with that. But I worked on it as we were putting it out, and the first time I read it, I was blown away by just how complete it is, how thoughtful it is, and it really guides you through the entire process and makes things so much easier. And it's a really wonderful product, so I commend it. You mentioned these resources. Are they available in languages other than English?
They are. Spanish is going to be primarily the additional language. So our website /caregiving basically also exists in a especially created the same information, but created particularly in language culturally appropriate at aarp.org/quadar. But then our resources are certainly available in Spanish, but we've also been working lately to ensure that, and this gets at that accessibility, where I talk about we want that the information to be accessible to all, focusing on the Asian American Pacific Islander population. Last year we worked with the CDC Foundation, and with their help, we were able to take our guides, information we have, and get them into Chinese, into Vietnamese, into Korean, and I believe Tagalog. So that's just part of our commitment to ensure that we know that family caregivers are very diverse, and we want to make sure that we're able to help all of them. And so those resources in language, again, you can get to those through aarp.org/caregiving.
Great, thanks, Bob. And the last question that I have before we turn it on over to you, if you have any questions, is for Rhonda, because we are sitting here in the middle of September already. And November is Family Caregiving Month. So is there anything that's noteworthy happening or coming up in our advocacy across the country in conjunction with that?
Well, yes, November is National Family Caregivers Month every year. As I mentioned, next week, the HHS, Department of Health and Human Services, and the Administration for Community Living, and a number of other federal agencies will be involved in releasing the first national strategy to better recognize and support family caregivers, again, due to the advocacy of AARP and others. And that's really sort of a catalyst and call to action for stakeholders, whether it's the federal government, state government, local government, healthcare providers, long-term care providers, foundations, employers, a whole array of stakeholders. It's going to have a lot of different potential actions and things that different stakeholders can do to help better recognize and support family caregivers in sort of whatever way that they might be able to do that. So we hope that that'll be something that will engage a lot of stakeholders and folks across the country in different ways, saying, how can I help? What can I do to really take action and bring about meaningful and tangible change and outcomes to better support family caregivers across the country. We also expect appointments of new members to the Raise Family Caregiving Advisory Council, which is made up of different stakeholders, almost all of whom have been family caregivers on the first time, including AARP's former national volunteer president, Dr. Catherine Alicia Georges, who is also a nurse and an educator as well. And so the next version of the advisory council, the new members and whatnot, will have their first meeting in November, which is National Family Caregivers Month. And the strategy will use that to really underscore the importance of AARP's existing and future advocacy to support family caregivers. In addition to the caregiver tax credit federally, we've been working and will continue to be working about looking at how Medicare can better support family caregivers, because a lot of people on Medicare are family caregivers, and a lot of people on Medicare have family caregivers. And it's important to look at how Medicare can better recognize and support family caregivers in dealing with the healthcare system and many other things. And also I will mention that our state offices are continuing to fight for improved supports for family caregivers. There's only a few states sort of left in legislative session at this point, but our state offices this fall are going to be gearing up for their advocacy in state legislative sessions and work with governors and state agencies in 2023. So they're going to be planning and laying out their groundwork and steps and advocacy plans for the coming year. So all of that is occurring on an ongoing basis.
Fantastic. And I can assure you that many, if not all of our state offices will be doing something on caregiving next year. So again, if you haven't worked with your state office and it's something that interests you, there's still time to get on this bandwagon, because it's a big bandwagon for us and has been going for many years and will continue, because there's always need for more support for caregivers, and that's why we do what we do. And with that, I want to open it up to questions from the floor. Because we're recording this, there is a microphone going around, so if you could just raise your hand and Kelly will find you with your question. Thank you.
So you all have done an excellent job sharing your mission with AARP. I'm a state president of AARP Kentucky. And my question is, will you share a little information with us about caregiving for veterans and what you have going on there?
That is a big area of focus. In part, veteran and military families is a big area of focus for AARP as an audience. So we have, a number of the guides that I've talked about, we've created in special versions for veteran and military families. So our AARP guide we have a guide to caregivers that we worked on in conjunction with the Elizabeth Dole Foundation. And so that also is, it's all available. Actually, those are available in two places online. One is certainly on /caregiving that I keep referring to, aarp.org/caregiving. Also, if you go to the veteran and military family section. It's funny, the financial workbook that I mentioned, the first version we created actually was a veteran and military guide, because that was really where we saw the greatest need based on Jessica's experience and her knowledge. So we've also, in our work with employers, have a toolkit for employers to understand the special needs of veteran and military family caregivers that might be a little bit unique. So it is an audience that we are very focused on ensuring that we have resources for them.
Yes, and I can talk, I'll mention both some federal and state level work in this regard too, in terms of supporting military veteran caregivers. We've endorsed a bill federally in Congress, both in the House and Senate, that's bipartisan. It's the Elizabeth Dole Home and Community-Based Services for Veterans and Caregivers Act. It's passed out of the House Veterans Affairs Committee, could come up for a vote as soon as potentially this month in the House, and it would expand access to home and community-based services for veterans through the VA, through a range of different means. It would help establish sort of a one-stop shop website to help give family caregivers of veterans information and tools and resources, and expand respite and support for caregivers of veterans as well. We've also endorsed another bill in the Senate that would look at establishing a pilot program to help provide assisted living services to veterans as well. Also, when we talked about the National Caregiving Strategy, there's this body called the Race Family Caregiving Advisory Council that has representatives from lots of different stakeholders that help advise and put together that strategy and report to Congress. But there are also a number of different federal agencies that are represented on that advisory council, and the VA is one of those agencies as well. And so we do a number of things in terms of advocacy for caregivers that benefit caregivers broadly, including military veteran family caregivers, but then also some of our advocacy is specific to family caregivers or military veteran caregivers. I'll also note, for example, that I think it was our New Jersey state office worked on a wounded warrior tax credit, for example, a few years ago that was specific to caregivers of veterans, for example, and I know our state offices may do an array of work and advocacy relating to the veteran community and supporting caregivers of veterans.
Great. Do we have another question out there?
Good morning. Thank you. My name is Susan Feiner. I'm from Maine. And I'm wondering if you've prepared a sort of report card on the various candidates up for election in November in terms of where they stand on these key issues, because I can't imagine there being a lot of support from one of the political parties for expanding aid to caregivers.
Well, let me say that, first of all, we have a large voter education effort to help make sure that policymakers and candidates and whatnot are aware of the power of the 50-plus voter, because the 50-plus population votes a lot in elections. They make up a significant portion of the voting population and can really impact the outcome of elections in this country, especially in midterm elections, sort of non-presidential years. So a lot of our state offices have been engaged in making sure, one, first of all, that 50-plus voters know what the rules and deadlines and timing and whatnot policies are in their states and communities so that they can exercise their right to vote. And then also, too, our state offices work in a variety of ways to help. They might host debates and forums or town halls. They might do video voter guides with information. They help educate candidates about AARP's position on issues. And again, this will vary. Different states may have different strategies about how they're engaging elected officials or candidates for offices, but it's something that our states across the country, state offices across the country are engaged in heavily, but whether it's at the state level or federal candidates for office and whatnot. And I will say that actually family caregiving does have bipartisan support. I think a lot of legislators on both sides of the aisle also have personal experience in their own families and see the impact that caregiving can have on their constituents and whatnot. So the Credit for Caring Act that I mentioned, that's bipartisan in both the House and the Senate. The Raised Family Caregivers Act that I mentioned, the national strategy legislation, that was bipartisan in the House and Senate. Obviously, things are more challenging these days in terms of getting bipartisan things through Congress and whatnot, but caregiving does have the ability to help bridge across the aisle, Republicans, Democrats, Independents. A lot of those, even 50-plus folks across those party lines support a tax credit like the Credit for Caring Act.
Yeah, and we will have a panel this afternoon, bipartisan, to talk about AARP's voter engagement work. Next question.
No, I don't want to stand up, but I will stand up. My name is Jennifer Wyatt. My name is Jennifer Wyatt. I'm from the state of North Carolina. I've been a caregiver for both parents, my husband from time to time. And what I would like to know is, what is AARP doing to connect with the community of family primary care providers and assisting those who become caregivers in terms of knowing about some of these resources? Many times people become caregivers and they're either new to the age of 50 or not in the age of 50, and you may not see someone who directs you, such as a social worker, until it gets to a dire point in the person's care. What I would like to see is in family practices a unit where there are people who are not necessarily social workers, but could be social workers, who are there to keep those patients in that practice connected and knowledgeable. That's a big piece that's missing in the medical primary care providers unit.
I couldn't agree more. And it's unfortunate, though, so on one hand, when you look at every day 66,000 people in this country become a family caregiver, roughly 2/3 of those, 60%, are becoming a family caregiver because of something in a short-term medical condition. So their primary care physician, the healthcare system is likely going to be the first place that we could reach them. And I'll be completely honest that we've had a really tough time, and we're not alone, because when we talk to physicians, we talk to their practices, and there's there's a belief that they're already giving the information that's out there. And we talk to caregivers like yourself and find out, oh no, we're not, we're not getting that information. And so, we're looking to understand, how can we, we've tried a variety of things, some working with practices to say, okay, what would make this easier for you? And we find, that doesn't work. So, we're not giving up on that. We're looking for, organizations that, maybe there are some good healthcare provider organizations, health systems that get it. Actually, the VA is one that has really worked to make healthcare or family caregiver supports more embedded. But know that this is one of our top priorities, looking to understand how do we get there, because when I talk about making sure that caregivers get the information they need, that is that's the family practice, the family care, the primary care is one of those key locations. We've seen models around the country where there's been better success. You got to make it real easy. There was a community in California that actually gave us the idea for what we're doing with 2-on-1. And they had some good success, so we may have some opportunity to embed, if you have it, the family care practice location, to say, okay, just call 2-on-1. That's a little bit easier for them, but just know that we agree with you, and we're fighting, and we're looking, and we're working to try to make that happen. We're just not there yet.
And there's things that obviously can be done outside of a policy context and then in a policy context. And I think that's part of the kinds of things that we're looking at in terms of, in the context of Medicare, how to make sure that family caregivers are getting the information, education, resources that they need, whether in Medicare or other things. And we do work with a number of different kinds of healthcare providers in terms of supporting family caregivers. But you've definitely identified a need, and it's something that we're working to try to address. But thank you for bringing it up.
Yeah, and I think that's a perfect question to end this on, because it elicited an answer from both of our guests about why we do what we do and why we're not done with it. Because there's always something more to do, finding a better way to reach out to people, and it's why AARP does what it does, and why we would welcome working with you all on it with the retired educators who can help educate the public and legislators of this great need. And with that, I hope you will join me in thanking Bob and Rhonda for this really great discussion. Thank you. Thank you.